Welcome back. This next section is called Ask FPA. If you have a medical question, you could send it to tv@fpalex.com and include your name if you would like us to use it on the air. Tonight's question is, do I need an annual Medicare Wellness exam? Asked by Robert Anderson of Lexington, Kentucky. And my next guest to help answer that question is Ms. Amanda Ford, a Medicare Wellness nurse at Family Practice Associates. Welcome.
Thank you, Dr. Fox.
Well, the simple answer to that for me is yes, you need one, okay? That's the simple answer. But tell us why, and tell us a little bit about the Medicare Wellness, which is not always associated with the physical exam.
Correct. And Medicare Wellness acts more as a complement to your physical exam and your regular appointments with your primary care physician. And basically, it's just more of an extended visit that you're getting to sit down with your nurse or your nurse practitioner and really hone in on all the assessments, the risk factor assessments, and also do a bunch of different things that your healthcare provider doesn't exactly get to go over with every little 15-minute visit that you have with them.
Well, let's talk about some of those things because I find them interesting. You send me notes on all my patients on how they do on the test, and let's start with the TUG test, okay? What is that?
So the TUG test is the timed up and go test that we use to evaluate fall risk. And what we do is we have the patient go from a sitting position, stand up and walk 10 feet for us, and then walk back. And basically what I'm looking for is I'm looking for a steady gait. I'm evaluating to see how many seconds it takes the patient to do that test. If it takes them 13 seconds or less, that means they're at a very low fall risk. Anywhere from 14 to 29 seconds is going to put them at a higher fall risk to where we're going to need to talk to them a little bit about fall risk prevention.
Now, you assess for the fall risk, and if somebody's young and they just turned Medicare, they think, well, this is a silly test. But as they get older, it may become important, and preventing falls, especially to break a hip's important.
Correct.
So if they don't do well on that test, you're going to talk to them about fall prevention. Give me some examples of that.
We basically talk to them about the little things that they can do around their homes to help decrease falls in their home, as far as throw rugs, securing throw rugs, wearing shoes, lighting their hallways as they're at nighttime so when they get up to go to the restroom at night, they can see to get to the restroom.
You also, if it's a really bad test, may recommend some assist devices.
We do. If they score anything higher than a 30 to do the test, then we automatically talk to their primary care doctor about a walker or cane or some kind of ambulatory device.
You also do some depression screening, which can be pretty common in the elderly.
It is. We do.
Tell me about that.
So we basically use just a small little risk factor assessment to look for depression. We score basically using a not at all. We ask them a series of questions, and we just kind of look to see where they fall in that category.
So if you pick up a depression, you can help from a social or behavior standpoint. Also might talk to their doctor about a medication.
We do. We talk to them about whether or not they feel like they would benefit from talking to somebody, and if so, we can refer them out to someone to speak with, or then we let their primary care doctor know so they can further evaluate for depression and talk to them about medications.
You do one thing that everybody's worried about is cognitive or dementia or Alzheimer's. You do a little bit of screening for that too.
We do. We do a cognitive impairment screening or a mini mental state exam. And basically we just use a series of questions to evaluate whether or not the patient is at risk for cognitive impairment.
And if you pick up a bad score on that, we might be able to at least start some medicine or start an evaluation to see if it's really something to worry about.
Yes, if they score anything higher than low on that as well, we let their primary care doctor know so they can start working with those interventions.
All right, now you also go over some benefits that are provided. Now, the exam itself is free, okay? It's a Medicare, they want you to do it, but you also talk to them about some other screening things that they might want to have done that Medicare encourages and will cover.
Yes, sir. The most popular right now is the hepatitis C screen everybody's hearing about on TV. For anybody that is born between the years of 1945 and 1965, 70% of the people living with hepatitis C right now were born between that age group. So Medicare is providing a free one-time screening for hepatitis C.
Bone density?
We do bone density exams as well for any female from the age of 50 to 85 and any male from the age of 70 to 85. We do this once every 2 years to evaluate for osteopenia or osteoporosis. Again, early prevention with those, we can get them started on medication.
people who are smoker also may qualify for some CT scanning.
Yes, sir. Lung cancer is very high, as we know, with anyone who has been a smoker, a current smoker, or anybody that has even had a previous history of smoking. So anybody that's a current smoker or has smoked within the past 15 years, they have to be asymptomatic, fall within the age range of 55 to 77, and then they also have to have smoked at least a pack a day for a year.
Well, that's great information.